Hello and welcome to the Tuesday edition of Video Clips. As usual, I'll start with a couple of announcements. First of all, we're just 6 weeks away, I think it is, from my autism boot camp. I've mentioned this a couple of times. I think that there's a lot of misunderstanding about autism. We've got very polarized factions in the autism business about treatment. Some people insisting nothing can be done, it's all genetic. Other people making claims about supplements and that sort of thing. So we're going to take the Wellness Forum Health science-based view, apply it to autism and its causes and treatment, and try to give people the best advice possible about what causes this, how to avoid it, and when it can be avoided, and also what to do that's productive. So that's coming up. We're taking enrollments for fall semester. Diet and lifestyle, again, will be offered. 39 CMEs for doctors, 39 CEs for nurses, nurse practitioners, for dietitians, and then why and how to withdraw from psychiatric drugs. And so I believe it is next week, or I can't remember exactly the date. Look at our online calendar, but I'm doing a conference call for people to learn more about this. So if you'd like to participate in that conference call or hear the recording of it, if you're watching this after the call has already taken place, just call our office at 614-841-7700. This course is designed for anybody who is dealing with this issue, ranging from the patient who's taking the drugs and says, I want to stop taking them, to the family practice doctor or social worker or psychologist or family member, anybody who's helping individuals who want to get off these drugs. So that's a little smattering of things to come. There's always a lot going on here. You know, we have 3,500 hours of programming. If you're interested in learning from us, we can keep you busy till the end of your days. So send me an email at pampopper@msn.com if you want to know more about learning opportunities here. All right, so a couple of interesting things to talk about today. According to a new study, just avoiding animal foods is not enough to reduce the risk of coronary heart disease. In order to benefit from eating a plant-based diet, people need to focus on choosing optimal foods. I've been talking about this for a long time, the very big difference between avoiding eating stuff and actually choosing the best foods. The study involved over a couple 100,000 people who were followed for 20 years, and the researchers reported that adopting a plant-based diet comprised of whole grains, fruit, vegetables, nuts, and legumes significantly lowered the risk of CHD. On the other hand, a plant-based diet that included a lot of refined foods and sugar-sweetened drinks increase the risk. So in other words, it isn't just enough to not eat animal foods. You have to choose the right foods. According to lead author Dr. Ambika Sadhuja, I probably butchered that name and I'm sorry, just because you're vegetarian or eating more plant-based foods doesn't necessarily mean you have a healthy diet. It's important to think about the quality of foods you're consuming, more whole grains rather than refined grains, more whole foods rather than juices. That's the right direction to take. The researchers noted that in previous studies, some of the limitations were that diets were defined as being vegetarian or not, and all plant foods were basically considered equal. So you probably know people who eat a plant-based diet or even a vegan diet, but it's not a very healthy one. In this study, however, the researchers differentiated between healthy plant foods, less healthy plant foods, and animal foods, and then ranked intake by quintile. Healthy plant foods included whole grains, nuts, legumes, fruits, vegetables, vegetable oils, tea, and coffee. Unhealthy plant foods included fruit juices, refined grains, sugar-sweetened beverages, and sweets and desserts. In an accompanying editorial, Doctors Kim Allen Williams and Hina Patel point out that a plant-based diet is more environmentally sustainable and that it has the potential to reduce healthcare costs. They wrote, quote, if, for example, widespread adoption of plant-based nutrition reduced the incidence of hypertension to 25% of the current rate, this could result in savings of nearly 30% of the Medicare budget. However, the caveat is you have to not just avoid the animal foods, but choose optimal foods. So the next time you go shopping for food, here's the way you should look at the farmer's market or the produce section of your grocery store. Walk in and say, I've got to make sure that I pick up some of the drugs called cruciferous vegetables. These are the healing foods, the foods that make your body strong and lean and fight off disease and that sort of thing. I want to get some of those drugs referred to as stone fruits, peaches and cherries, and make sure I get some of the drugs called berries and some of the very powerful drugs called leafy greens and root vegetables. And that's a whole different way of looking at it. It's great to be crystal clear on what you're not going to eat. That's actually a much easier decision to make than trying to make your meals up of the most optimal foods. And by the way, When people say that they don't know what to do with these foods, I'm a pretty simple girl. On our member site, you will see a video, if you're a member, called A Tour of Dr. Pam's Kitchen. I show you how I do it with lots of frozen food in the freezer, batch cooking of potatoes and beets and other foods that I like to eat a lot of. You know, you can make a meal out of potatoes and salad 6 times a day if you need to. It's not interesting, but it's healthy. Well, actually, I think it's pretty interesting. You'll be surprised how much you grow to like it if you eat it. The more good stuff I eat, the more stuff I want, and the more my desire for the things that I don't want to eat anymore goes away. I'm shocking myself, actually, even when presented with vegan goodies, and it just happened before I came in here to film. You know, everything we make in our kitchen here is vegan. And they had vegan gluten-free blondies, and they look delicious, and I just don't want them. So if you told me years ago that that would be the case, I would have told you you were nuts. But the more of this good stuff I eat, the less I want of that. All right, now on to a very serious matter, one I think a lot of health professionals are becoming increasingly concerned about. Clostridium difficile, C. diff, we'll refer to it as, is a resident bacteria in a healthy gut microbiome. We all have some of it. Normally it doesn't cause disease. So we all have some of this in our guts and even in other parts of our body, and as long as the population is really, really low, we don't have problems. However, even small increases in the population of C. diff can cause several conditions, including mild diarrhea, colitis, toxic megacolon, sepsis, and even death. This is a very serious matter. An individual's susceptibility to C. diff infection, or CDI, results from dysbiosis, or a microbial imbalance that results in the inability of an individual's beneficial bacteria to control growth of the commensal C. diff population. Once C. diff is established and takes over, the bacteria produce toxins that attack the lining of the intestine and produce patches of inflammatory tissue and decaying debris in the colon. Again, very serious. Now, there are several ways in which the microbiome can be damaged, which include poor diet, constipation, diarrhea, inflammation, and taking certain prescription drugs such as antibiotics, NSAIDs, and steroids. C. diff has changed a lot during the last several years. Infections tend to be more severe, recurrence and mortality rates are higher, and one of the reasons is that new strains are resistant to multiple antibiotics. This is an argument for why we need to be very conservative in the prescribing of antibiotics. I would say that for the people that are coming in here, probably 25 or 30% have used antibiotics in an inappropriate way sometime in the recent past. Symptoms of C. diff infection include watery diarrhea that can be as many as 15 times a day, severe abdominal cramping, increased heart rate, fever, blood and mucus in stools, nausea, dehydration, kidney failure, and weight loss. And as I mentioned earlier, all this can lead to death. The most common causes of C. diff infection have historically been hospitalization, particularly when antibiotic treatment is given. But what is really becoming scary is during the last couple of decades, an increasing number of people outside of the hospital environment are developing C. diff infection, including individuals who would not normally even be considered at risk. There are several reasons why this is. While antibiotic exposure has historically been recognized as the primary cause, one study showed that 45.7% of patients with CDI had no exposure to antibiotics in the 90 days prior to their infection. Another study showed that 52% of patients had no antibiotic exposure prior to the onset of infection. So what is going on? What's causing this increase in community-acquired CDI? Well, one factor is commonly used drugs such as proton pump inhibitors. While not all studies show that there's a relationship, lots of meta-analyses do show a relationship, and the FDA has issued a warning that PPIs do have the potential to increase the risk of CDI. Examples of proton pump inhibitors that you would recognize the name are Nexium, Prilosec, and Prevacid. These are drugs that are advertised regularly on TV as, take them every day and you can keep eating your chicken and fried chicken and french fries and all the other bad stuff you want to eat. So lots of people take these drugs. Other classes of drugs present these problems too. Corticosteroid drugs also increase the risk of infection, but also the risk of mortality when you have an infection. I've been putting out quite a lot of information about the dangers of steroid drugs, and sometimes they're absolutely required, but they are also overprescribed, and most people are not given options other than taking those drugs. One important contributing factor is consumption of animal foods such as beef, chicken, and pork, which have been found to contain C. diff spores that can survive cooking even at the recommended temperature. So we always thought that if you cooked the animal food really, really well, you would get rid of all the pathogens and things that could make you sick. Not necessarily true. So it seems that many, if not most, cases of CDI in community settings can be avoided by eating a plant-based diet, using antibiotics only when absolutely positively you have no other choice, and avoiding corticosteroid drugs and proton pump inhibitors. The adoption of an optimal diet almost always eliminates the needs for PPIs and significantly reduce the risk of conditions for which antibiotics and corticosteroids would normally be prescribed. So a lot of this really does come back to making the right dietary changes. Now, when taking an antibiotic cannot be avoided, whether you're in the hospital or whether you're in a community setting, the use of probiotics at the same time can significantly reduce the risk of CDI. Recent review of 19 studies that included over 6,200 subjects showed that beginning to take probiotics as soon as antibiotic treatment begins lowers the infection rate by as much as 42%. The sooner the probiotics are started, the better the results, with the greatest reduction resulting from starting probiotics within 2 days of the time you put the first antibiotic pill in your mouth. Several other studies have confirmed that taking probiotics will reduce the risk of C. diff infection if used in conjunction with an antibiotic regimen. In fact, I was shocked when I did searches online in PubMed how many studies I was able to find really quickly showing this to be the case. Now, it's ironic that while CDI can be caused by taking antibiotics, antibiotics are often prescribed to treat it. In some cases, plant antimicrobials can be effective alternatives and do not cause the same side effects as antibiotics. In serious and life-threatening cases, fecal transplant is effective, resolving 92% of cases. And since people die of CDI, C. diff infection, knowing these types of strategies is very, very important. The best option is to prevent it, however. The increasing incidence of this infection, particularly outside a hospital environment, is very concerning, should be a major wake-up call that we need changes. We need changes in the food supply, we need changes in diet, we need changes in prescribing habits, and we need to make those who are vulnerable to a CDI, C. diff infection aware of options that can reduce their risk if they do have to take an antibiotic or find themselves in a hospital. All right, that's all for today. As usual, pass this on to anybody who you think might enjoy watching it, and I will be back to you on Thursday with more news.